1 of the Constitution of India. Thank you, sir, for giving me the time.
Thank you so much. Honorable Member Sri Lavu, Sri Krishna ji.
Thank you, sir. COVID pandemic has redefined the word warriors because our doctors, medical staff, sanitation workers have battled the pandemic from the front line to keep 130 crore Indians safe, sir. But it was disheartening to hear the news of a mob pelting stones on doctors in Indore or attacking ASHA workers in Bangalore, sir. However, the spirit of our COVID warriors is undefeatable. An example of that is Dr. Zaika Syed from Indore, who despite being injured said that incident won't deter her from doing her duty. We should all appreciate, we should all salute the doctors who have almost spent 8 to 16 hours, anywhere between 8 to 16 hours, wearing their PPE kits without actually accessing the toilets also, sir. We should all salute them. And as a lawmakers, it is our duty to protect these COVID warriors, sir. This bill defines healthcare service personnel and provides for stringent penalties in case they are attacked. Violence against healthcare personnel is made a non-bailable offence and the fines have increased to 5 lakh rupees, sir. The bill also limits the trial period to 1 year. While these amendments are welcome, the Epidemic Act itself is due for upgradation to incorporate learnings learned from the COVID, sir. Lesson number 1, which we can learn, being a new disease, we have taken a trial and error approach to deal with COVID. Premier research institutes find new information every day, which needs to be transmitted to the last medical worker working in the very last of our 7 lakh villages, sir. An example of that is Health Ministry guidelines in March were given as that 3-ply masks won't work, but later on they have reversed it. Constituting an expert committee that will rapidly diffuse these learnings will limit misinformation, empower rural health professionals, sir. Lesson number 2, in Andhra Pradesh, we have the highest per capita testing, sir, and we have highest per capita recovery as well. Andhra Pradesh efforts have highlighted the need to fight pandemics in a decentralized manner, be it door-to-door surveys, contact tracing, or district-specific control rooms and hotlines. Andhra Pradesh has taken the fight against the COVID to the grassroots, sir. Andhra Pradesh 6,846 primary healthcare centers, Anganwadi centers served as the nodal points here, sir. The center and states can take a leaf out of Andhra Pradesh's approach to create decentralized strategy. If needed, the Epidemics Act can be changed for this, sir. And the lesson number 3, the law itself was formed more than 120 years ago when Bombay was struck by a plague. Conditions have changed immensely since then, sir. More people live in cities, migrate frequently, and travel in airplanes, which hadn't even been invented then. A new epidemic law is needed to reflect these times, sir. The law should take a rights-based approach to protect citizens' interests. It should clearly define the government's duties and citizens' rights during an epidemic. By doing this, responsibilities of key government functionaries can be identified and accountability can be fixed. Medical professionals will also become more accountable, sir. This is needed even today as Medical Council of India reports extremely low number of complaints of medical negligence, sir. I'm not disrespecting, last half a minute, sir. I'm not disrespecting any medical professional here, sir, but if you have seen, we have been reacting and brought this law wherein a medical professional can be saved, sir. But at the same time, we are not actually auditing why a patient is doing what he is doing. If he is reacting in a very aggressive way, they should be audited. And if you see the numbers in an unstarred question number 4,558, complaints filed stood at 156 in 2017, sir, 140 in 2018, 16 in 2019, which is very less. So we need a proper audit. We cannot just say, just because doctors have all went out of duties and did a strike, we cannot bring this laws up. What we are going to wait? Are we going to wait for all the patients to bring up a strike because of the medical negligence? So let's do a proper audit, sir. So we hope the central government will incorporate these suggestions and use the learnings from COVID to better handle new pandemic. With that, we reaffirm our YSR Congress party will support for this bill as it protects our brave soldiers. So thank you very much.
Thank you. Honorable